I'm David Ridenour. I'm president of the National Center for Public Policy Research, a free market think tank, and a company shareholder. I have two very quick questions. First, in recent weeks, my organization has spoken directly with the CEOs of Aetna, WellPoint, and Humana about Obamacare's risk corridor provisions. To a man, each declared that if available, they will accept a taxpayer bailout based on Obamacare's weaknesses, despite the fact that the insurance industry lobbied for this flawed law, while a majority of taxpayers consistently oppose it. So my first very quick question to you is this. Will UnitedHealth be the one company, perhaps comparable to Ford during the auto bailouts, that reaps the reputational rewards and appreciation of the taxpayers by announcing that it will reject any taxpayer bailouts that may become available through Obamacare's risk corridor provisions? My second question relates to the scandal related to the Veterans Administration's promise to provide quality health care for our nation's veterans and its failure to deliver on that promise. From the VA scandals to VA scandals to Britain, to Canada, even Sweden, it's clear that government-supplied healthcare model is inferior to private care. As the CEO of a company that makes it possible for many to afford top-notch private care, I assume you agree that private healthcare delivery systems are the best choice for patients. Given the terrible stories coming out of the VA, many have called for a replacement of the current VA system with one that gives our nation's veterans the same opportunities for good health care that customers of UnitedHealth enjoy. That is, a system in which veterans are given private health insurance policies of their choice, perhaps modified somewhat given the unique needs of some veterans, and the government picks up the tab. This would drive customers to UnitedHealth, which would be good for shareholders, and even more important, give veterans access to far superior care compared to that which they are now receiving or failing to receive from the VA. Given this, are you or the company calling for, lobbying for, or in some way working to encourage the federal government to change the way it provides health care to veterans, to give veterans access to vastly superior private health insurance plans? Do you support such a change for the VA?
Well, let's take those one at a time. First of all, I think if you followed the company, you know that our position on exchanges has been, we think, thoughtful and careful with respect to how we participate in them, and the themes of that have been along the lines of believing that for this policy objective of the country to move forward and do that in a sustained way, the exchanges need to be shaped and managed in such a way that they are sustainable and sustainable on their own. We recognize there are transitional support to them, and we would have no idea whether we would ever be in a position to participate in that support. We are interested in moving forward with the broad objective of expanding coverage and making coverage available to all Americans. We expect that these approaches will be shaped over time. I would point out that despite the fact that we have not participated extensively in exchanges, we have paid over $2 billion in taxes that are directly related to ACA policies, in part in support of elements like that. And as we go forward in terms of participation in the exchanges, we would participate and engage with them in a way that complies with the laws in which they were established. And if that means that we are participating in some of the economics that move in that direction, then we'll comply with those laws. We are interested in the exchanges being self-supporting and sustainable. Secondly, in terms of the VA, we're very sympathetic to the situation and challenges that are being presented there. I would suggest that as an organization over the years, we have been open to a wide spectrum of approaches about how we can help and engage to work collaboratively across the healthcare landscape to really address any problem or challenge where we think our capabilities or experience might lend themselves. And in that instance, we'd be open to a variety of forms to assisting to see if we can provide relief or help. But we would do that in an open, collaborative way with those who are the sponsors of that, and don't really have a policy view about how those services might best be presented. But we would really just have a helpful posture in terms of how we can work collaboratively, regardless of what approach is used. We think a whole spectrum of approaches might apply.
If I could ask a quick follow-up on the risk corridors, they're set to expire 3 years from now, and you view them as a transitionary phase. So my question there is, would you commit to not lobbying for their extension?
So I can't really speculate on how the regulations might proceed or how legislative policies might proceed on this, so I really can't respond to that. What I would come back to is that we would be strong advocates of sustainable markets that have been positioned to sustain themselves long-term on their own, designed in that way, and we'll maintain that posture. But I can't speculate on what legislation or what policy activities will go forward or how we will respond to those. We would just like to, again, be helpful to see that whatever mechanisms to extend coverage in a responsible, sustainable way goes forward.
Thank you.
Thank you.